Telehealth visits should be a seamless and intuitive experience for clinicians, patients, and practice staff to connect from wherever they are. Athena Telehealth doesn't require additional software or integration, and Athena One customers can be up and running with our fully embedded HIPAA-compliant telehealth solution in less than 2 days. For practices using third-party messaging solutions, our API will allow you to share the Athena Telehealth virtual visit link in your messaging to patients. In addition, for practices building their own patient-facing applications, our SDK will support the delivery of an integrated virtual visit experience within your application. Here's how Athena Telehealth works. Martin has an appointment scheduled for 11 a.m. with Dr. Bond. He received a confirmation email when he scheduled his appointment last week. He also received a text reminder 15 minutes prior to the virtual visit. Both messages include a link to join the call, but if needed, a practice staff member can easily resend it to him right from AthenaNet. The link will open in Martin's browser. There's no app to download. He agrees to the terms of use and informed consent. Then, Athena Telehealth will check Martin's network connection, speakers, microphone, and camera to ensure a successful virtual visit. Martin can also view the visit workflow in Spanish if he chooses. Athena Telehealth will remember his language setting for future visits. Martin is now in the virtual waiting room. It indicates that his session is live, encourages him to relax, and features tips for a successful virtual visit. If desired, Martin can have a caregiver, family member, or interpreter join the call from their own device. Each person can set their own preferences for how they will be seen on this call. When Liza, the practice nurse, is ready to begin intake and sees that Martin is online and ready for staff, she can launch the virtual visit and connect with Martin. Intake over a virtual visit is supported the same as in a clinic encounter. Liza progresses through the intake steps on the left while talking with Martin in the window on the right. Liza completes the intake and lets Martin know the provider will be with him shortly. She can leave the call at this point or remain in the virtual room until the provider enters. Athena Telehealth virtual visits are integrated into the rest of Dr. Bond's schedule and indicated with a video icon. Before the visit, Dr. Bond can open her patient's chart to review the reason for visit from intake so she can be ready for the virtual visit. When Dr. Bond sees that Martin is online, she joins the call and conducts the virtual visit. If necessary, she can adjust the video to full screen or mini view based on her preference. She can position the window to maintain eye contact with Martin, making this virtual visit feel more personal while still allowing her to document the encounter. Dr. Bond can also share her screen to share additional patient education and confirm any necessary patient-related information. When the exam is complete, Martin and Dr. Bond can both leave the call. Dr. Bond can complete and sign off on her exam, and telehealth-specific coding and billing rules will be triggered automatically. Easy to integrate and intuitive to use, the fully embedded, HIPAA-compliant Athena Telehealth solution gives your practice the flexibility to deliver convenient, virtual care to your patients.